Good morning, everyone, and thank you for joining us. My name is Tuyuan, and I'm the project lead for UPS Flight Med. Today, we officially kick off a project that represents a major step forward in urban healthcare. Let's work through what this project means, what we will achieve, and how we will work together. Let's see the second one. As a project lead, I would like to start by outlining the purpose of this meeting. So here's introduce the UPS Flight Med projects and objectives and expectations. We'll introduce the project background, goals, and expectations, clarify each person's role, review our timeline, and finally open the floor for input and discussion. This will set the tone for how we will collaborate moving forward. Let's go to the project background. So the slide 3 is project background. In major cities like New York, like our Boston, delivering medical items quickly can be a real challenge. Traffic delay can slow down the transport of critical items like blood, vaccine, and test sample, like the cat's human stool samples. With drone technology, we can bypass these barriers and respond faster. This project combines our logistic expertise with a strong commitment to innovation and public health. We can support UPS innovation and healthcare mission. And next, project objectives. Our core objectives are to build a drone-based medical delivery network in the big city like New York City, Boston. Ensure it integrates smoothly with hospital system. Comply with FAA regulations and gain community support. And ultimately deliver emergency medical item faster. Next, project scope. The project scope of this including 5 key competencies. The first one is establish legal and safe drone flight path with FAA. The second one is deploy a fleet of autonomous drones built for medical deliveries. Third is develop a secure tracking and routing system. 4. Integrate everything with hospital logistics tools. And 5 is and conduct a full-point rollout with 20 medical facilities across New York City. Next, project stakeholders. Let's now take a closer look at the people who will make this project a reality. We have a diverse and high-capable team. Laura Kim, our project manager, will oversee day-to-day operations. She will help manage the timeline, keep tasks elegant. Dr. James is our chief medical advisor. He brings valuable things into how hospitals operate and what frontline healthcare professionals need. His input will ensure our drones deliver real clinical value. Alan is our FAA license officer. His role is critical. Safety standard isn't easy. Alan will help us make sure what stay compliant and avoid delays. Priya is our software lead. She'll ensure the drone tracking platforms connected properly with hospital system and that data is easy to use. Maria, our community manager, will help us build trust with the public, especially in areas where drones will operate. She'll handle our tech, education, and public feedback. Johnson Wu, our legal risk advisor, will identify potential legal issues before they become real problems. His real assessment will help us operate with confidence. And Elena, our procurement lead, will manage vendor relationships and cost tracking. It's important to note each stakeholder have a different level of technical knowledge. As project lead, I will tell her how I communicate with each of them. Some will need deep technical breadth, while there are other benefits more from visual summarize and real-world examples. This will help us avoid misunderstanding and keep collaboration smooth. The next one, communication plan. So a strong communication plan is what holds this team together. First, we will have weekly check-in meetings with the core team. This will be short, about 30 minutes, to make sure we're staying aligned on goals and deliverables. Next, we will have monthly stakeholder updates. This will summarize progress, identify blockers, and allow space for feedback from our broader team, including legal, compliance, and community partners. We'll also use a shared online workspace, most like Microsoft Teams or Zoom, or where we can store meeting notes, share files, and sign text. Last one, there's our escalation path. If any critical risk, whether technical, legal, or community related, we have a clear reporting chain to get it resolved quickly. The goal is transparency, accountability, and keep everyone connected, even if we are not in the same room. Next, timeline. Here's our timeline, broken down by quarters. So we got 4 quarters here. In quarters 1, our focus is on planning. This includes selecting public hospital sites, preparing legal documentations, and securing airspace approvals from the FAA. We will also start ordering equipment. In Q2, we will move into testing and development. Drones will go through trials runs and will test software with hospital IT teams. We expect bugs. We'll catch and fix them early. In Q3, we will begin pilot delivery operations. This phase is crucial. We'll gather feedback from hospitals, track delivery items, delivery times, and see how the system performs under real-world conditions. Finally, in the Q4, we move to full implementations across all 20 sites. If all goes well, this sets the stage for expansion into the other cities. Each includes a checkpoint review where we'll adjust the timeline if needed. Flexibility is important, but we'll aim to stay on track. And the second one, how we measure success. This is very important for us. So, how do we success? We've set clear things, like the first one is delivery time. Delivery time is very important. We aimed to deliver items in under 15 minutes or 10 minutes. We plan to do the 10 minutes, but we can start from the 15 minutes from dispatch to arrival. Volume. Our monthly goal is at least 5,000 deliveries. This means this won't just be a demo. We'll be operating at real-world scope. And next, we want a 99.9% success in delivery precision. Not loose package, no wrong things delivery, no damaged contents. And the next one, satisfaction. At the end of the day, we serve people. We will collect feedback from hospital staff and aim for 90% satisfaction rate. If people feel this improves patient care, we will know it's working. And beyond numbers, success also means public trust. If the community see our drones as safe, helpful, and responsible, or of the privacy, then we'll have built something sustainable. And the next Q&A and discussion. So before we close, I want to thank everyone for the focus and support you about this Kickoff. Now I'd like to open the floor. Do you have any questions about the timeline, your roles, or the technology? Are there any concerns you would like us to address early on? Your feedback today helps shape how we move forward. After the section, after the meeting, I'll send out a follow-up email summarize action items and link to key documents. Together, we are building more than a delivery system. We are building trust in future healthcare. I just want to end with this. What we are doing here is more than just in the new system. We are building something that could save lives, change the world, expression in hospitals, and show the world how technology can truly help people. It is not going to be perfect on day one, and it's okay. We'll just start. What matters is that because we are working together with a hard shared goal and a belief that this project can make a real difference. So, thank you for being part of the journey. Let's move forward with focus, with care, and with confidence that we're building something important together. Thank you guys. Thank you for the meeting, and see you next meeting.